Hello, my name is Kate Rademacher, and I'm a Senior Technical Advisor at FHI 360. I'm delighted to be here as part of the conference to present on behalf of my co-authors our poster, which you can see here, entitled The Development of Programmatic Guidelines for Family Planning and Menstrual Health Integration. Family planning and menstrual health are closely related areas that are often not effectively integrated, which can result, of course, in missed opportunities to improve sexual and reproductive health. The current literature does discuss and explore some of the evidence around these important linkages, but little to no guidance is currently available for implementers who want to effectively integrate family planning and menstrual health services during routine programs. In November 2020, FHI 360 hosted a two-day virtual technical consultation on the topic of contraceptive-induced menstrual changes. Following this meeting, a global task force was convened of experts around the world who developed a research and learning agenda focused on contraceptive-induced menstrual changes. In addition, a subcommittee of the task force identified the need to build consensus around programmatic guidelines for family planning and menstrual health integration. As a result of that work, you can see 6 areas that were identified for recommended action. And these programmatic guidelines are designed to target girls, women, and people who menstruate at key stages across the reproductive life course, from puberty to menopause. In the interest of time, I'll just touch a few of them, but we do have a forthcoming manuscript that will be available with additional information. Just briefly, a couple of recommendations. You can see here again this top 6 categories. In the first one, improving education and awareness, one of the top priorities is to provide puberty education and comprehensive sexuality education with information about contraception and menstrual health, as well as detailed information about the menstrual cycle and how it relates to pregnancy and fertility, and using evidence-based curricula and teaching methods throughout the reproductive life course. In addition, you can see improving client-level interactions. As part of that, we need to provide services at the same delivery point, as well as offer referrals when same-day services are not available. For example, this could include provision of menstrual health products as part of family planning counseling, or providing family planning services or referrals during community-based menstrual health education and product distribution events. In addition, we need to ensure that family planning users or potential users understand contraceptive-induced menstrual changes and have the information that they need to make educated decisions about what type of contraceptive methods they want to use and when. In addition, moving forward to number 4, you can see on the slide, it's critical to ensure that both menstrual health and family planning needs are adequately addressed when providing services to populations with special needs or unique needs. This can include youth, perimenopausal people, people with disabilities, people living with HIV, those who are in the postpartum period, refugees, migrants or other mobile populations, sex workers, people in the LGBTQ community, survivors of abuse or violence, and those who are incarcerated, among others. All of these populations have needs for both family planning and menstrual health, and they need to be addressed comprehensively. In conclusion, it's critical that stakeholders, multiple stakeholders at the global, national, and local level look for opportunities and act on them to effectively integrate family planning and menstrual health. This can include donors, governments, program managers, healthcare providers, and a key priority area is providing integrated service delivery models. We look forward to sharing the global guidance document in the coming months. Thank you so much for having me, and I look forward to accepting questions, which you can email me at the address on the slide, krademacher@fhi360.org. Thanks again.